Knee gel injections, questions and answers. So in this video, we are going to cover some very common questions about knee gel injections. We will cover, is the gel and hyaluronic acid injections the same thing? What is the gel injection made of? Who can use the gel injection? Who should not take the gel injection? Should I do steroid or PRP before doing gel? What is the length of pain relief expected? What can I do to maximize the results? What are the side effects? Can you do the injection if the knee is swollen? So, is the gel injection the same thing as the hyaluronic acid injection? Yes. Gel injections are the same as hyaluronic acid or hyaluronan injections. All three terms can be used interchangeably. In a healthy knee, both cartilage and synovial fluid are involved in lubrication and cushioning during movement. In knee arthritis, there is wear and tear of the cartilage and also a reduction in the amount of synovial fluid. Overall, this leads to less lubrication and cushioning, which then leads to inflammation and pain. So by introducing the gel within the knee joint, friction is reduced, which then leads to less inflammation and pain. Now, there are many types of the hyaluronic acid injection. They vary in source, structure, and molecular weight. This determines the amount needed and the dosing schedule. So what is the gel injection made of? Hyaluronic acid is a complex sugar molecule that occurs naturally in the body, and it is present in the eyes, skin, and joints. There are two main sources for the gel. The first is the rooster comb. Enzymes are used to break down the combs and the hyaluronic acid is extracted. The hyaluronic acid is then purified by removing proteins and other substances that may lead to allergic reactions. The second method is with bacteria. The bacteria is cultured and stimulated to produce hyaluronic acid. The hyaluronic acid is then purified by removing bacterial waste products. Who can use the gel injection? Hyaluronan injections work best in mild to moderate arthritis, but in the case of severe or what is called bone-on-bone arthritis, it can be used as a last-ditch attempt to avoid surgery. A person who is obese or has bone-on-bone arthritis is less likely or unlikely to show any improvement. So, it is not just about the degree of arthritis as demonstrated by the X-ray, but also about lifestyle and bodily factors. Who is not a candidate for gel injections? There are certain cases where the gel injection may not be given. For example, allergy to components in the gel mixture, bleeding or clotting disorders, infection within the knee joint, and infection in the skin around the knee. Hyaluronan injections have not been tested on pregnant women, and it is not yet known if it or components mixed in it pass into the breast milk. So, it is best to avoid during pregnancy or while breastfeeding. Before doing a gel injection, should you try steroid or PRP first? Before moving to a gel injection, you don't necessarily need to do a steroid or PRP first. A person can use gel as a first option. The pain relieving effect of gel acts slower than that of the steroid. So when the gel is given, it can be mixed with the steroid. So the steroid will give the initial rapid pain relief while we wait for the gel to start to take effect in the next few weeks. If you did a PRP injection course and it did not work for you and you are considering the gel, wait 2 months before doing the hyaluronan injection. So what length of pain relief is expected after you do a gel injection course? In the case of mild to moderate arthritis, the gel injection can last 6 to 12 months, after which repeat shots can be done. However, if a person has bone-on-bone arthritis, it can be used as a last-ditch attempt to avoid knee replacement, but relief is not guaranteed. Additionally, if you are overweight or obese, the length of pain relief can be considerably less than 6 months. After the injection is done, what can you do to maximize the level of results? For the next 2 days after the injection, you need to avoid high-impact activity, jogging, carrying heavy items, and standing for long periods. Some very mild exercises, such as leg swings, may be recommended for the next 2 days post-injection. We recommend what we call active recovery by recommending the proper level and intensity of exercises. With any knee injection, it is recommended that physiotherapy, weight loss where applicable, can be done to maximize the effects of the treatment. Additionally, knee bracing and proper footwear to realign the feet and knees can also be considered. Collagen supplements and red light therapy may also be added to your regimen. The majority of collagen supplements on the market are derived from cows, but a fish collagen is also available. What are the side effects of the gel injection? Some of the possible side effects are temporary pain at the injection site, which is normal for any type of injection, slight swelling at the site of injection, temporary stiffness in the joint as the knee needs to get accustomed to having a bit more fluid in the joint. There's also a small risk of infection. If my knee is swollen, can I still do the injection? Now, if a knee is swollen due to a flare-up of the arthritis, it can be drained of the inflammatory fluid and injected with the gel or a mixture of the gel and steroid on the same day. However, if the fluid appears to be filled with pus after being drained, that is a sign of infection and antibiotics will need to be started. Only after the infection subsides can we do a gel injection. So, I hope that information was useful. If you want to book an appointment, you can call 747-5297 or 308-3370. You can also WhatsApp us your x-rays and MRI scans on those same numbers. We are located in Chincuna Road, Cunupia. We are at number 4 Chincuna Gardens in Chincuna Road in Cunupia.